Hi, I'm Dr. Nathaniel Wright at Tennessee Equine Hospital. I'm going to talk to you today a little bit about eye care.
Hello, Dr. Nathaniel. So the first question I'm going to ask you today are what are some signs and symptoms that my horse may have eye issues?
Yeah, so horses' eyes are pronounced on the side of their heads, and so they are really prone to getting eye problems. Trauma is a big cause of that, but we also see horses that have some systemic diseases that cause eye problems, and then horses actually self-injure their eyes occasionally. So there are all kinds of problems that can happen with horses' eyes. When you see a horse that has a swollen eye, a horse that's eye is puffy either on the upper lid or the lower lid, a horse that has excessive drainage, either clear tearing from the corner of the eye or like copious kind of mucus type discharge coming from the eye, a horse that is squinting excessively, or a horse that is reluctant to let you touch near the eye, excessive redness. There are a lot of things that can be going on, but any of those things should indicate, hey, there's an issue going on. Even maybe a tendency towards shying away from something on the right side or the left side of the head that might indicate a vision issue. So I think any of those things are the first indicators, hey, something's going on with this horse's eye that may need some attention.
Should I bring my horse in to see a veterinarian if I suspect an eye problem?
Yeah, I think that's the best thing to do. I think that a veterinarian is the right professional to take a peek at an eye. We tell people that eye issues are emergencies. There are a few things that are big emergencies: lacerations, laminitis is a big emergency, and eye things all kind of fit in the category of an emergency on the weekends or at nights even, and we're all happy to get out of bed to come see those. And occasionally it will seem like a wasted call because it'll just be an itchy red eye. But we think that those eye problems, when they are a real deal, when there's a laceration or a horse that has recurrent uveitis like moon blindness, those things need to be addressed right away. And so we feel like it's justified to call a veterinarian out to come see those things, make a proper diagnosis, and put together a treatment plan quickly so that we get on the correct meds right away and don't waste any time, because eyes can really go badly quickly, and we want to make sure we're on the right plan right away.
What is some preventative eye care that can help the health and well-being of my horse?
So keeping an eye on the horse's eyes is really important. Like, you need to be looking every day at your horse's eyes to be sure that they're open, that they're clear, that they're equal, that both eyes are open in similar amounts, that there's not a bunch of drainage, a lot of stuff we talked about before. Preventative care, I think fly masks are really helpful to keep the bugs out of the horse's eyes. Occasionally when horses have runny eyes, I think it's really helpful to rinse their eyes out with saline to get some of the debris out. Horses have big open areas around their eyelids that allow lots of trash to get in there, such as hay and dust and debris. So anytime you can rinse those eyes out to get all the garbage out will help prevent scratches. But I think most important preventative care is just keeping a close eye on the situation and not ever ignoring horses' eyes, particularly during the time of year where they're wearing fly masks. Because we have folks occasionally that will go for several days without ever seeing the horse's face under a fly mask. So it's very important to look under that mask every day and make sure that both eyes look normal.
Why is it important to avoid self-diagnosing horse eye issues?
Yeah, we all are guilty of trying to self-diagnose things on ourselves as well. Eyes are a different case for sure, because particularly a lot of our customers have leftover eye meds from a prior eye injury. And it's really easy to feel tempted to go ahead and jump in and put some of those eye medicines in, but they're all diagnosed for very specific conditions, and some of those can have disastrous consequences if you're incorrect. If a horse has a scratched eye and you put steroids in that eye, you can really cause a big mess. And so it is far better to have a veterinarian come out, stain the eye, be sure there's not a scratch, and then make a proper diagnosis so you end up on the right medication. You can cause some serious and potentially permanent damage to a horse's eye by not taking it seriously enough or by putting the wrong medications in at the wrong time.
So one last question for you.
Yeah.
If my horse has an eye issue, what are some treatment options that are available?
So a lot of our medications, so simple situations like a scratched eye, we typically use ointments, so a lot of topical treatment with ophthalmic ointments for antibiotics to kill bacteria, antifungal drugs to kill fungus, drugs to dilate the pupil, which help with comfort, and also help with the flow of the fluid through the eye. And then occasionally we will use drops if we're unable to get the ointments in the eye. We have horses that have serious enough eye conditions that they require hospitalization, and oftentimes those horses are on medications 10 to 12 times a day, which is an excessive amount to come in and wrestle with the horse to put meds in. So we have a catheter called a subpalpebral lavage catheter, or SPL, that we insert through the corner of the eyelid, and it allows us to put liquid medication in the eye multiple times a day without all the fighting associated with prying the lids open and putting meds in. So the SPL kit is a really nice tool for using here in the hospital, and actually sometimes even on the farm for the right patient and the right owner that's comfortable with those sorts of things. We even, sometimes those horses that are prone toward traumatizing their own eye when it's itchy or irritated, we'll use this mask called an eye saver mask. It looks a lot like a racing cup to a blinder, but it is complete and it covers the eye 100% so that the horse is unable to traumatize the eye and unable to traumatize that SPL catheter I was talking about, so that we protect the eye and protect the horse from damaging itself. That's probably about it.
Well, thank you for your time today, Dr. Nathaniel.
Thank you.
If you have any questions regarding this or any other topic, please give us a call at our main hospital at 615-591-1232 or visit our website at www.tnequinehospital.com. We are always here to help you and your horse.